ICU beds dwindling at Bay Area hospitals as coronavirus cases surge across the state. The plea from doctors ahead of the final holiday of the year. And good evening. I'm Juliette Goodrich in for Elizabeth.
I'm Ken Bassita. We begin tonight with the surging number of hospitalizations across the state. They have soared almost 37% in just the last 14 days. And the ICU hospitalizations are also up, more than 35%. But as KPIX 5's Kenny Choi reports, there's a big difference between what's happening in Southern California and here in the Bay Area. Kenny?
That's right, Ken. Travel overall here at SFO Airport compared to this time last year is down by about 80%. Overall, though, we're starting to see an uptick in people traveling across the country. And that's one concern for health officials as they are starting to see what's happening in hospitals in Southern California getting ready to go into crisis mode. The state of hospitals in the Bay Area is very different from what Southern California is seeing right now.
Hospitals that are running out of staff, having to use rooms that they don't traditionally do, longer than normal, much longer than normal wait times in emergency departments.
ICU capacity has already dipped to zero in Southern California and the San Joaquin Valley regions, while the Bay Area is hovering a little over 10%.
I think very important, critical difference between the North and the South right now.
Officials making year-end pleas for people not to mix and mingle.
I did not get together with my family this holiday. We did the Zoom calls, but I just, again, just want to stress the safety.
Just plan on doing the same thing, staying inside and waiting until everything calms back down.
The Department of Health's latest 4-week projection indicates ICU capacity will not improve enough in Southern California and is a reason for extending the regional stay-at-home orders.
This surge is still our biggest yet, and we cannot afford to have a Christmas or New Year's surge on top of the surge.
So the earliest that the Bay Area can lift those stay-at-home regional orders would be on January 8th. Health officials would then make projections about ICU capacity 4 weeks out. But as we have seen in the past month, even if it's not a mandatory state order, local counties can implement those stay-at-home orders if they choose. We're live at San Francisco International Airport. Kenny Choi, KPIX 5.